Good evening. We are pleased to present information on mental health. And here to speak to us is Dr. Lauren Colston from Coping Corners, LLC. Good evening.
Good evening.
Can you briefly tell us about your work with child and educational advocacy?
Sure. So I've been working in the field of psychology for over 17 years in various different treatment settings, environments, working with youth as young as the age of 5 and well into adulthood. And one of the things that is really passionate is being able to work with children and adolescents. And of course, what comes with that are their families, their parents. And a lot of people don't always have the information that they need to be of support to their youth. And also, sometimes they're not really knowledgeable or know all the ins and outs of the educational system or the mental health system, depending on where they are in their lives. And so, one of my priorities, one of my tasks, is being able to provide information to youth and parents and families on how to navigate those systems, where to access information, just knowing differences between different types of plans and services for their child, and also kind of the reality of what can we have in a certain time period and what's probably not accessible right now just to the restrictive services. We're trying to start with least restrictive to most restrictive. So being able to provide that information to youth and families in an outpatient setting, inpatient setting, and as well as an educational systemic environment.
Oh, thank you for that. What are the common underlying challenges that immigrant youth and diaspora families face that might affect their mental health, and how can we best support and engage these communities?
That's such a good question because we're in a time period and have been for a very, very long time in which there's a wide range of diverse populations, all of which that are suffering from different mental health issues, economic issues, things of that sort. And when we're working or supporting specific types of families that have immigrated to the U.S., just being able to recognize and understand their experiences of not only their own cultural backgrounds, growing up in a certain environment, their experiences, normal or traumatic or atypical, and then also kind of just the experience of being able to immigrate into a different country and not knowing, sometimes the language or the full surroundings of where they are, what they have access to, what they don't have access to. And so sometimes what we find is that not just the mental health is impacted, but some of those underlying issues come with trauma, language barriers, access to certain mental health care. If certain immigrant families don't have insurance, don't have a social security number, even, residence, just a place to stay and rest their head. So kind of thinking about Maslow's hierarchy of need of, those basic, ground needs all the way up to self-actualization. And when we're working with a lot of immigrant youth and families, sometimes those basic needs are being unmet and they directly impact, the youth, the adult, the family system, their stability in their mental health and how to navigate certain things within that system. And it could be in the home, it could be outside the home, because of course, as we see, because of diversity, we're also seeing children being enrolled in schools. And so they, sometimes they're the first, English speaker in their family. And so some ways to be able to help the youth and the parents and the family is being able to work from a culturally competent lens.
Yes.
In which, being able to understand or recognize what language is needed so that we can be able to have a fluid conversation about your needs. So having translation available or translation services, not using the child to translate, not using a family member to translate, that's putting them in a compromising situation versus the person that's receiving that support. Now they're working to receive that support in that sense. Knowing local and government policies and access to certain community health and wellness opportunities. Yes. So like different wards have different immigrant representatives that's their sole purpose is to be able to connect those families to specific resources, education, economic, and physical and mental health opportunities for them. And then also being able to have that continuity of care, that communication, recognizing that sometimes families are not always reachable because they're not always have access to communication, fluid communication. So to not give up on those families, but to continue to be diligent and being able to communicate and provide them with the resources, not only that they're asking for, sometimes they don't even know what's out there to ask for it. So kind of saying, hey, I learned this information. I would love to provide it to you. I'm going to give you a copy of it within the language in which you're able to read. So even that is something that's really important of being able to provide that support to immigrant families and be culturally competent and trauma informed.
Yes, thank you so much. What are some strategies to remove the stigma related to mental illness?
And that's such an important question because we all know that there's a lot of stigma around mental health, and it comes from the thought of it's scary, it doesn't apply to me, it's taboo, even the terms like I'm not crazy or you're a shrink, things like that. Terms like that kind of maintain that stigma, even sometimes when diagnoses are thrown around of, oh, you have bipolar. And, sometimes when those labels are being thrown around, it maintains the stigmas.
Yes.
So being able to break some of those stigmas, having conversations like this, thoughtful, intentional conversations about mental health, throwing away the labels until the person gets connected to a professional that can authentically and effectively, underneath an ethical standpoint of being able to say, you meet this criteria. So instead of having a diagnosis saying, hey, I'm noticing that you're a little bit more sad nowadays, or I'm noticing that you don't come out as often, or you're a little bit more nervous or something like that, recognizing the behaviors, recognizing the emotions and how they impact our day-to-day life, and having those intentional conversations with loved ones, with people that we see going through something, or we know that an experience has happened, and kind of being acknowledging and caring and kind of telling, this is what I see, this is what I notice. And it's not a label, it's coming from a concern.
Right.
And so those are a couple of ways of breaking down that stigma, even having more open dialogue within a school setting, within the workplace, within family environments. When we know that we all are going through something as a family or as a community, having open conversations where people can just talk authentically about their experiences and how they're feeling and how does it affect them and how does it affect their family, things like that. Sometimes it doesn't have to be labeled of, a mental health impairment. It could be just a conversation of human beings that helps open the door of, hey, did you recognize how what you were just telling me impacts your work? Or how you recognize how what you're going through at work impacts your relationship with your child. So sometimes just having that connection can help the person be more open, more comfortable even of sharing their concerns, and even be more willing to go and talk to a professional, even on a consultative kind of standpoint. Even that foot in the door is really important. And having positive experiences within a therapeutic setting is another way. Once we're in there, once we're already receiving the services, the stigma doesn't stop. So how can we in those sessions be trauma informed and culturally competent and authentic and really present, with the individuals that are coming? That continues to help break that stigma, because now that they're got in the door to sit and have these conversations, to pour their hearts out and start, telling things that are, in a vulnerable way.
That's right.
Helping to make sure that they have a fruitful experience. I don't want to say positive or negative, because each experience is different depending on what they're talking about, but having something fruitful, having those seeds, so that when they leave those sessions or leave that conversation, they can go and tell another family member or friend or colleague, hey, I actually went to a session and it wasn't that bad. I would love to share my experience with you, and hopefully you can do the same thing if you ever need it. So, I think sometimes when people say, let's break the stigma, They think, it's before we get, to the point of actually receiving the services, but it's while we're still receiving those services too. And then the same token of not only the clinician being able to provide that service, but the person across from the clinician being able to be honest about what they're going through so they can get the best help that they need. And if they don't like how things are going, being able to be authentic of saying, hey, I think we shifted, I really want to work on this, and the clinician
Right.
shifting with them. And that reduces that stigma, because sometimes they feel like, all right, doc, tell me what to do. And it's like, that's not how it works.
No.
Let me
No.
break that stigma of how therapy works, and let me talk to you about how we can work together so that I can be of service to help you reach your goal and what you want to work on, short term or long term. And just having conversations like these is just a first step, and having the information out there, either on poster boards or in commercials. And the more and more we see it, the more and more we talk about it, the more and more we can break down those walls. And all of us kind of really focusing on how we can really fill back up our cup
Yeah,
of being mentally sound, mentally well,
that's it.
recognizing when our cup is starting to become depleted, and figuring out ways of how we can fill that cup back up again, because it's a continuous cycle, it's a continuous work. There's always going to be something that hits us,
right.
like the pandemic hit us, different situations have hit us all, across the board or individually, and just recognizing it for one is a first big step, and then talking about it is the next one, and then receiving help from somebody else outside of yourself is the next one, and changing our behavioral patterns and what we do when we are stressed or feeling sad and depressed or going through grief and loss. Like, what do we do with that?
Right.
That's another step. So it's a constant, continuous growing
Yes.
process.
It's a journey.
It's a journey. That's a
Yes.
good one. It's a journey.
Yes.
It's a continuous journey. As we grow, we learn more about ourselves. And as we learn more about ourselves, we learn what's helpful and what's not helpful, who is helpful and who is not helpful, and what we enjoy and what's not for us.
Absolutely.
And hopefully we evolve, and not just as individuals, but as a community.
Wow. Thank you so much for being here.
Thank you for having me.
This was very vital information, and I'm just hoping that it will reach someone and really help to support our communities. Thanks again, and have a good evening.
Thank you. Thank you as well.
Thank you.